Hello, what's up, you guys? Usmle Geek here, and in tonight's lecture, we'll discuss the Treponema pallidum bacterium in the microbiology section for the Usmle step 1. So, what is the Treponema pallidum? Well, Treponema pallidum is a bacterium that is the main causative agent for syphilis in humans. Well, Treponema pallidum belongs to the spirochetes family. So what do you mean by spirochete? Spirochete, when a bacterium under the microscope takes this shape, this spiral shape, we call it a spirochete. So what are the characteristics for this bacterium? So if we want to talk about the Treponema pallidum, Treponema pallidum is a motile bacteria. And the main reason for this motility it has something called axial filament. So this axial filament lies between the peptidoglycan and the outer membrane of the bacteria. And this bacteria is unlike any other bacteria. This bacterium can't be isolated on an ordinary media, and it can't be stained. Okay. So the main reason for the motility, as we say, is the axial filament. The axial filament like helps the bacteria rotate around its axis or around itself. Okay. So this bacteria has a spiral shape. We said it belongs to the spirochetes family. It's motile and it's so delicate. What makes it delicate? Its cell wall. Its cell wall is so fragile and so thin. And a fact about the cell wall of this bacterium, it's like the gram-negative bacterium, but it doesn't have an endotoxin. Okay? Okay. So let's talk about the pathogenesis of syphilis or how syphilis is transmitted. So syphilis is transmitted mainly by sexual contact or by direct contact. Like when there is someone who is infected with syphilis and you came in contact with the skin lesions or with the lesion, the syphilitic lesion, you can be easily infected. So this is direct infection. Also sexual. Another thing is through blood. It's like when you transfuse a infected blood. Another thing also is transplacental, like when the mother is infected with syphilis and it infects the baby with syphilis. So how the bacterium enters the body? Is it through respiratory droplets? Is it through food, water? No, not any of that. This bacterium enters the body via the skin, through breaks in the skin or pores in the skin or maybe even intact skin. And this bacteria travels to the blood and reaches the blood vessels, causing a chronic inflammation in the blood vessels, which leads to what we call an endarthritis obliteranis. So, any syphilitic patient has three stages: a primary stage, a secondary stage, and a latent, or what we call a tertiary syphilis. So what happens in primary syphilis? Well, in primary syphilis, the patient is highly infectious. He can literally infect anyone. Another thing is that if you take a blood sample and you look for antibodies against this bacterium, you will find the serology positive. Okay, another thing is that this patient usually presents with something called a chancre. A chancre is something like an ulcer which you find on the skin. And this chancre is usually painful. And the patient also presents with bilateral lymphadenopathy. Okay. So that's for primary syphilis. Okay. Regarding secondary syphilis, the serology in this patient will still be positive, okay? And the patient presents with a variety of symptoms like nasopharyngitis, macular papular rash, nephritis, hepatitis, and it comes with generalized lymphadenopathy. So notice here, in primary syphilis, we got a bilateral lymphadenopathy, while in secondary syphilis, we got a generalized lymphadenopathy, okay? And the time of appearance of these lesions and disappearance of them is literally variable. It's around, if we're talking about primary syphilis, the time taken to produce a chancre, um, it's around 2 to 10 weeks, and it resolves in 3 to 6 weeks. While in secondary syphilis, the lesion here is not called chancre, while it's called a condyloma latum. Well, this lesion takes around 2 to 12 weeks to form, okay? All right. So that's all what we need to know regarding primary syphilis and secondary syphilis. So last but not least, the tertiary syphilis. Actually, 1/3 of the patients enter this stage, and this stage, what we call the most aggressive or the most destructive. What happens here is a chronic inflammation, a chronic progressive destructive inflammation occurs that forms a granuloma. So when a chronic inflammation occurs, it mainly forms a granuloma, and this granuloma actually like deposits on in the CNS, in the brain, in the CBS, in the heart, in the liver. Okay, all right. And the main lesion here is what we call gamma. So what's gamma? Gamma is the granuloma that's formed and deposited as a result of um, the chronic inflammation. Okay. So, what is the latent stage? A latent stage or a latent syphilis is mainly the patient will come to you and will not have any symptoms. He's not complaining of any symptoms of the mentioned symptoms above. But if you take a blood sample of this patient, you will find out that he is positive. He got antibodies against this bacteria. Okay? All right. So that's the clinical manifestations that we mentioned. So another topic that we want to discuss in this bacterium is the diagnosis. So we have already said that this patient has Treponema pallidum or has syphilis. So how I make sure that this bacterium is the causative agent for this syphilis? Um, so there are a lot of ways to diagnose this bacterium also. You can do a dark field microscopy. Like you look for this bacterium under the microscope, a dark field microscope. So literally what you will see is a dark field, like really dark, and you will see this spirochete motile and kind of moving, okay? And you will see the spiral form of the bacterium. Another way is also under the microscope is to add a Fontana stain, and you will find this bacterium stained in a yellow or a brownish background. Also, another way, or another form of microscopy is the immunofluorescence microscopy. Um, and what you really do here is like you add a fluorescent substance, and this fluorescent substance it binds to the bacterium, mainly antibodies, and it will fluorescent, okay, and give you this greenish light neon uh, shape. Okay, all right. Also, we have another way of testing for this bacterium. Actually, we don't prefer using direct methods to diagnose this bacterium because this bacteria is kind of highly infectious. So we fear for the laboratory workers that they may get infected with this. Okay. Another way is, but before we discuss the other ways, I need to give you a note. Don't you ever give antibiotics to this patient and then ask him to do some tests because the bacteria will literally be like few in the body and you will not be able to diagnose it. So don't take antibiotics prior to the tests. Okay? Okay. Also, this may come up to your mind, like, why don't we use a gram stain or any stain to know this bacteria? So we mentioned earlier that this bacteria isn't an ordinary one. It can't be stained Okay, it literally can't be stained, and it also can't be isolated on any media. Okay, all right. So also we got molecular testing, where we can do a PCR to recognize the DNA. It's usually helpful for early or atypical infections. We mentioned the microscopy, we mentioned the molecular testing. Also, we got serology. Well, serology is a really important way to identify, to detect or diagnose this bacterium. And there's a variety of ways to use this. On a way we could be specific or non-specific. We can take a sample, a blood sample from the patient, and we can add a Treponema pallidum extract, and we can put some fluorescent labeled antibodies on this mixture, and these antibodies will literally bind to the antibodies the patient system forms against this bacteria, and it will fluorescence. Okay, this indicating a positive one. This is one way of serology. Well, actually, there are a lot of them, but this ain't high yield, and there's will be a waste of time if we talked about all serological methods. So that's the summary and key points of all what we mentioned earlier. The a glimpse of the shape of the properties of the bacteria, the pathogenesis, the diagnosis. All right, that's it, guys. This is all what we need to say for the Treponema pallidum bacterium, for the microbiology for step one. This is actually the first of many lectures that we're going to give in the microbiology section. So stay tuned, guys, and can't wait to see you in um another lecture, upcoming lectures. Okay, peace out, stay safe, and see ya.